Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
You know, the work of nurses in particular, I think, look, they're at an eye level, and there isn't much mystery to healthcare, right? It is sort of highly tangible, and they sort of know what it is in terms of its impact on families and lives. And there's not a lot of varnish to it, for better or worse. I think I think they're in it for the right reasons, is my experience, and they also see some of the challenges and complexities there. So I share your compassion and sympathy, right, for the integrity and sort of efforts of nurses across the country. So it's
For sure.
So
we put our business leaders and executives on a pedestal, CEO, CFO. At the end of the day, they're people just like you and I, and they have the same fear. I think what drives the state of healthcare today more so than anything is fear of change, fear of the unknown. And so at some point along the way, you discovered that, as we all did at one point or another, that, wait a second, there is a better way to do this. There is an opportunity here for savings in the PBM space. Where did that occur for you?
Well, there's a lot there. I think, I think one of the genesis points for me was what I alluded to, earlier at the beginning of this conversation around data and information. And what I saw is, as the market was shifting, I mean, you mentioned full insurance. Disproportionately, most plans and employers are in self-insurance, which would suggest that they have more control of their destiny. But what's sort of occurred in the marketplace is actually, in the self-insured markets is actually, there's been this sort of transfer of assets and authority to health insurance companies and their affiliated corporate forms, right? Whether it's PBMs, you've got specialty drug markets, you now have group purchasing organizations, you've got all these different types of corporate forms that, frankly, LegalZoom is making good business at every time United Healthcare or one of the other larger insurers sort of comes up with a new idea, because it means they get to create a new LLC in Delaware and a new website in theory. And there seems to be no end to that, right, just as an address of the market. But in theory, the self-insured market was supposed to allow a small business owner, a Main Street business owner, a pizzeria, more control of their destiny. And what I was finding as I was working with innovators in the market, sort of thinking about how to problem solve, was when they asked questions about access to data and information, and so that they could make realistic and reasonable recommendations to the fiduciaries, i.e. the plan, the employers that run the healthcare system for an individual employer, that information was often lacking. It wasn't provided for. There were a myriad of excuses as to why it couldn't be provided, even though the basis of it was the individual employee data, the individual employee. It was Ray or Joe's information, who represents a certain composite of way healthcare is being purchased and administered in the country. And that became sort of a point of, contestation, right? Where in conflict, where even if employers were willing to push and ask for that information, you got pushback from brokers and consultants, or the employer, or the health insurers themselves, or the PBMs. And that's what sort of got me really sort of engaged and interested in this question of, well, how are you even supposed to fix the problem if you can't define it, right? That you couldn't even discern necessarily what price is, or even understand what cost trends were, because the information wasn't being provided. And I think that wrinkle of it alone, I think, has also alerted policymakers and other stakeholders that something may not be right here, right? That because you look at the other macro trends, that the promises that have been offered through at least a vertically integrated system and a self-insured system, by mergers and acquisitions, and even out of the Affordable Care Act, was that you were going to see at least two things. One, you were going to see better healthcare outcomes, and you were going to see a reduction in price or cost, out of pocket cost for patients. And on both those promises, on both those commitments, we're failing.
Yeah. So for, the CEO or the CFO listening and they're trying to wrap their head around, okay, this is my second, third largest expense after payroll.
Sure.
And we're seeing increases year over year. And I think there are kind of two schools of thought. To some big giant, organizations, they're like, it's budget dust that, we can budget for this. And that's kind of their approach. And I think that's a horrible approach for your shareholders if that is your approach, because you're literally, I'm talking to some organizations that literally spend $500 million a year on healthcare.
Yeah.
And what might be budget dust to you is actually a meaningful amount of money. And how could that be repurposed to further your organization's mission? And so for the folks that are interested in how do I dial this in, what would you do if you walked into an organization and you saw that they were, say, self-funded in an ASO arrangement with one of the big insurance carriers, and, let's say they're spending $10 million a year, but you didn't see any cost containment in the plan. It was essentially what the broker recommended. Would you get involved if it were you that were kind of running the show?
Yeah, I think there's a couple different options here. One is, first of all, what's on the plate of a benefit administrator is pretty full plate, right? And I think, and you alluded to this, the sort of complexity of healthcare alone versus, say, other benefits you're considering. It really is a sort of different animal, right? And I think that if you're, the average benefit administration that has to think about other types of value propositions you want to offer your employee, it's daunting to think about what to do about healthcare, both on the medical side and on the drug spend side, right? And they're increasingly, obviously, under vertical integration, sort of related to one another. They play off one another. I think that's by design by vertically integrated companies, right? There's a myriad of antitrust questions and other things that we could sort of raise about that. But that's the first complexity. I think they have to be intentional about really being thoughtful about that benefit in specifically. Know that they're going to have to engage in a sort of thoughtful process. The second point is, again, what you alluded to. I think who you're working with as your trusted advisor, who the brokers are, is a critical decision. It's not just knowing, okay, I think our PBM is screwing us. The PBM may be screwing us, but your broker may be screwing you, to be really candid about it at times.
Oh, do tell, Joe.
And so you may need to take a hard look at a relationship that you thought was a trusted or reliable relationship for a long time, but they've taken an interest in or guided you down a path that is no longer reasonable, and they're baked in or have aligned interest into spread pricing models or other things that ultimately are driving up your healthcare costs.
Yeah.
And rebates in particular, as the measure of that, of the data point of that, becomes sort of too easy of a sexy eye candy to sell away. Smart benefit administrators who begin asking the right questions, they often enough, an aligned broker, consultant, or a vertically integrated PBM, and the health insurance companies will use rebates, as I describe it, as sort of the sugar candy to retain their clients. And it's sort of it's sort of mythology, right? At the end of the day, they're attaching returns of rebate dollars based on an artificial drug price that they've created or they constitute to begin with.
Yep.
And you're getting a return on a bad price to begin with. It's a game that you're not going to win. I, like you, Ray, grew up outside of New York City, but it's sort of like, look, the old card shark games that you used to see coming out of Madison Square Garden, and you could put $5 down, and you were never going to win the $5. You were never going to find the quarter underneath the walnut or whatever was underneath that.
3-card money, find the lady.
Yeah, it just was never. It's not even Vegas, right? It's a totally different scheme.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.